Sedentary behavior is defined as any waking activity completed in a seated or reclined posture that expends low levels of energy. Therefore, we spend much of our lives engaged in sedentary behavior, as it includes activities like sitting while watching TV, reading, using the computer, and hanging out with friends. Older adults are the most sedentary segment of the population. On average, 62% of an older adult's day is spent sitting. This indicates the importance of understanding what motivates someone to limit their sedentary behavior. Hello, I'm Kelsey Bittel, a graduate student at UNCG in the kinesiology department. In this video, I will describe work I am in the process of conducting to understand the motivational processes that lead some older adults to sit less than others. High levels of sedentary behavior are associated with an increased risk of chronic health conditions like obesity, diabetes, high blood pressure, cardiovascular disease, and cancer-related death. It is important to note that these risks are still evident even after controlling for individuals' time engaging in physical activity. Because older adults sit for such large portions of their day, they are at higher risk for these health conditions. It's important to limit sedentary levels to reduce the risk of these health conditions in older adults. One way is through motivation. What motivates someone to be active? It can be due to the enjoyment of activity, the expectation of a reward, or valuing the activity's outcomes. For example, an older adult may value the health outcomes of being physically active, which motivates them to be active. But the motives for someone to be physically active may differ from those motives to limit sedentary behavior. Behavioral regulations are different types of motivations that indicate underlying needs and conditions that contribute to an individual's motivation. There is a wide net of research looking at behavioral regulations in physical activity, but little work has been done looking at the regulations in sedentary behavior. This study aims to examine behavioral regulations to limit sedentary behavior and how it is associated with sedentary time in older adults. Older adults aged 60 and older completed an online questionnaire for the study. The questionnaire asked questions relating to reasons underlying people's motivations to limit time spent in sedentary behavior. Following the completion of that questionnaire, they wore an activity monitor on their thigh to track their sedentary behavior for the next 2 weeks. Past research has shown a positive relationship between behavioral regulations and physical activity. Specifically, behavioral regulations in exercise that have high autonomy, which is freedom of choice, relatedness, being close or connected to others, and competence, feeling successful and or accomplished when completing a behavior, have a positive relationship with physical activity. With behavioral regulations to limit sedentary behavior, it is hypothesized that 1. Individuals with behavioral regulations high in autonomy, relatedness, and competence for limiting sedentary behavior will engage in less sedentary behavior. And 2. Individuals with behavioral regulations related to external rewards and apathy towards limiting sedentary behavior will engage in more sedentary behavior. This study will use data from 202 older adults residing in Guilford County, North Carolina. Preliminary demographics for the participants in the study are 71% female, 75% white, and an average age of 70 years. Data cleaning and analysis related to the stated aims are underway. The expected findings from the study will help advance knowledge related to what motivates older adults to limit their sedentary behavior. These findings can be used to inform intervention efforts to limit or reduce sedentary behavior among older adults. Given that older adults represent the fastest growing segment of the population and the most sedentary, more effective intervention efforts could improve individual health, but also improve societal outcomes associated with caring for an aging population. Understanding an individual's motivation and what drives their motivation is important to understand why someone engages in a particular behavior. To effectively reduce or limit sedentary time, it is essential to understand the motives behind this behavior. Thank you for listening.